Hello viewers, I am your presenter, Ralia Bello. Welcome once again on our program on Health Hints, which is related to health issue. In our previous episode, we discussed about cancer, asthma, diabetes, dengue virus, and so on. In today's episode, we will talk about AIDS. We want to know what is AIDS. Here now with me is my special guest, Sir Bello A. Bello, Chairman Health Sector Reform, Sokoto State. Okay, you're welcome, sir.
Thank you.
The theme for this year is community lead. So, sir, we want to know how community leads.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وصلى الله على النبي الكريم. Assalamu alaikum viewers. Today we are on HIV/AIDS. As everybody knows, every year 1st December is World AIDS Day. We have the theme, as the presenter said, community leads. Community leads on what? Community lead in the care, in fact, in the prevention and the care and support for people living with this virus and are on treatment and are being supported, as well as protecting them from stigma and discrimination in the society. So how do we address these challenges? That's why this year's theme, community leads. It means the community will lead the discussion on this subject matter towards prevention, cure. There is no cure for now, but there is treatment that suppresses the virus to a level that the person infected can lead his normal life. HIV/AIDS is a process from the infection of the body. Every human body has immune system. Immune system is the watchdog or the protector or the army of the body to protect it from the invading pathogens, bacteria, viruses, fungi, name it. In this our case, it is the virus. That's why they call it HIV, human immune virus. Is a virus or is a organism that affect the cells in the body. The human body cell we call lymphocytes or white blood cells. This virus attaches itself to those cells in the body and damages the protection of the body. And that's why you see a patient with this problem, if he goes into the level of AIDS, because AIDS simply means acquired immune deficiency syndrome. If a patient passes from level of infection of the virus and no treatment, no care, the patient will subsequently, after so many days, months, years, fall into the level of that AIDS. At that level, many opportunistic infections. When we say opportunistic infection, there are different types of pathogens or germs, bacteria, viruses, and what have you. In this our case, it is virus that has caused this problem. Your body has no guard, no army to fight the invading pathogens. So your body is open. Any opportunistic disease can come. For example, tuberculosis can catch somebody, and any bacteria can just enter your body and start damaging you because you have no army now in the body. The white blood cells are taken over by this virus. So it's a very serious situation that needs attention. And for us to achieve this year they say, let the community lead in preventing the infection itself, and take treatment, go and test. If these viruses are in your system, take treatment. If you take treatment, the level of those viruses in the body will go down to the level that they cannot disturb you or even show any sign that you have viruses in your body.
What are the signs and symptoms of the virus?
So, sign and symptom of HIV virus in the initial stage, one may not even know he is carrying these viruses till he goes and gets tested for the virus. Are they there in his body, in his blood circulation, in all the serum in his body? So some of the signs you can see, you can have what do you call it, fever. Sometimes you start showing some unease in your body, some weaknesses. That is the initial sign. You see, you today you are well, tomorrow, you understand? And that's why, and sometimes because you have been going to the hospital or you have been meeting your doctor, giving all form of treatment, more especially when you start running, stool, diarrhea, and the fever on and off, weakness, always looking sick, to make sure you get tested. It may not be necessarily HIV infection. It could be another virus, like this virus of the this Qatar, corona, the not serious corona, because corona has long family, not the one we experienced in 2019. But this common cold, Qatar, is virus. So, but you can only find that if we test, and you get a result. And now, as soon as you are tested and you get a result, you start treatment, so that you suppress what we call the viral load. But that virus in the body, with that treatment, it will suppress. It will inhibit the virus to replicate in the body. So as you take treatment, in fact, those are some of the initial time before somebody reaches AIDS level, acquired immune deficiency syndrome. If it reaches that level, then it's a very serious situation. But if somebody comes to the facility earlier and detected, and in fact, now you can even test yourself. There are provision. Yes, there are provision with this scientific laboratory kits that you can test it yourself and know your status. And you go and report to the nearest health facility where they provide these HIV/AIDS services. They will counsel you and place you on treatment, because if you allow it, you know you have it, you allow it, it will continue to, your body will continue to damage, because many types of bacteria or other viruses or other fungi will enter your body and continue damaging you, because you have no guard, you have no immunity. And that's why we call it acquired immune deficiency. It means you don't have the guard. Look, imagine Nigeria without police, without military. Anybody can come and invade us and do what they like. Do the same thing. Your body, that is what we call opportunistic infections. Things like tuberculosis. It's very common. You see somebody with AIDS, with HIV. If you test, it's likely to have tuberculosis. That's why now we want integrate them and treat them simultaneously.
Can tuberculosis turn to HIV/AIDS?
No.
Because I saw someone has tuberculosis, but later they said it has turned to HIV/AIDS. So I want to know, is it really like that?
No. HIV infection is completely different from tuberculosis. In fact, that's why we say HIV, human immune virus. But in tuberculosis, it is not virus. You know, it is not virus, it is bacterial. That requires different treatment. So if somebody is having HIV infection and he also has tuberculosis, you treat them simultaneously, because the TB has come into the human body on what we call opportunistic infection. It is because you have no immunity in your body. Not only tuberculosis, many different things can enter your body and damage your body. So that's why if somebody reaches this level of acquired immune deficiency syndrome, then this thing has advanced. So we shouldn't allow it to advance to that level, and that's why we should go and test and know our status. When we know our status, we immediately commence treatment with this antiretroviral therapy. Okay. Yes, these are the drugs we give the patient, and it's free of charge. Federal government, state government, local government, it is provided free of charge. You don't pay any kobo to take those drugs. And you continue to visit your doctor, your nurses in the community, your community workers, and continue enlightening you so that you adhere to the treatment. Because what we don't like, you are giving treatment, you start taking, you abandon it. And it is very serious when you start treatment, you abandon it, later you then, there is what we call drug resistance. We don't like, if you get drug resistance, then you are complicating the matter. So tuberculosis is a different matter, but when people have no immunity or low immunity, then opportunistic, some diseases would take advantage.
How do people get affected by it?
So you are saying affected. So always try to, some people sometimes they confuse the two. The first one is infection. Infected. With I. The second one is affection with A. What is the difference? In infection, it is the HIV virus infection. It means when this viruses enters your body through those mode of transmission, either by sexual relationship, people using blades, unsterilized blade, or even shaving unsterilized, even this thing they do the hair, this thing. If they are not sterilized, what is important, sterilize them with the recommended sterilization chemical. And this blood transfusion, the blood has to be screened before it is transmitted to anybody, because these viruses could be there. With to affection, this word affection, that is infection. Then the affection is who are affected. In most cases, you find the patient relatives are affected because it concerns them. They have to now care for this their relation. And you find in most cases the problem we are facing of stigma and the discrimination. You can see because of fear, people that can contract this disease, people start avoiding the patient. And after all, it is not the only infectious disease. It's not the only disease that you can take from person to person. There are many diseases. You see, that's why we say the communicable diseases like hepatitis, cholera, meningitis, even malaria. You see, mosquito transmitted between one person to person by mere biting this one and biting the other and transmitting the Plasmodium falciparum, which we have very common here. We were talking of dengue virus last time. Dengue virus is a virus. HIV is a virus. So these things are there around us, and if we are not, that's why we want clean environment. So when we say affected, we mean the people, his relation, his friends, his wife, everybody are affected. Everybody attention will come to this human being, so that you support him, make sure he is taking his drugs, give him all the support, because you cannot take HIV by mere sitting in one place or by mere shaking. No, you can't get I mean, tuberculosis is even more. I mean, to get infected with tuberculosis than HIV, because in tuberculosis it's a matter of sneezing, coughing, or talking.
Or using one spoon.
Yes.
One spoon, eat
yes.
it together. Thank you. So we are going for our short break till we come back, and we'll continue from where we stop. Okay, so viewers, we are going for our short break till we come back. We'll continue from where we stop. We are back from our break, so we are going to continue. Sir, you are welcome from break.
Yeah, you are welcome.
Thank you, sir. What is community lead?
Well, this community lead in this year's World AIDS Day celebration, or creating awareness around the world, that the management scientists or system thinkers, they look at things holistically. That if people are allowed in the community to participate in the management of HIV or AIDS patient, is the better. Because many of people in the community, they show some fear of unknown. Because like I was telling you, you cannot get HIV because you are living in one place with the HIV, unless unless through blood or any mucus or any fluid from the body interact with your body. If not, there is no way you can get it. That's why I will tell people, when you go to the hospital, go with your new syringe, and if you are going to have injection, they have a technicality of disposing that syringe without it pricking somebody. We people who work in the hospital, we are vulnerable because we use these instruments, and we handle in the surgery, we handle. That's why we have what we call PPE, protective equipment, that will to protect ourselves. So when you put community in the process of planning, you discuss with them, you identify challenge and problem with them, you clear what they don't understand, they will be willing to come forward and get tested and commence treatment, because there is the strategy of 95, 95, 95 to be achieved by 2025, in line with Sustainable Development Goals of 2030. The 95%, if we can trace people in the society that they are tested, then you find out. The target is that make sure you identify about 95% within the community that have
AIDS.
Not AIDS.
Okay,
HIV virus.
So that means
yes, HIV virus 95.
HIV.
Then out of 90% you have identified, make sure you are 95% commence treatment. They should commence treatment.
Okay.
Because when they commence treatment, the viral load, what we mean, the numbers of this virus in the human body, the medicine will suppress them and prevent them from multiplying, and they will continue to die. Because if they are there multiply, they will continue to take over the remaining immune system. That is the white blood cells that God Almighty make them to do that job. So when you take treatment consistently, the viral load will keep on going down, up to the level that you don't even notice anything. Somebody will live normally and will continue to monitor. So, and the last 95 is that you will see that if there is no, what do you call it? If there is no more, people are not cannot spread it. So you are trying to achieve 95% people not to be infected. Not to be infected. Because when you suppress those who have it, it's not likely to transmit it to new patients. Yes. So that is the national strategy and the WHO strategy.
Okay, sir. What are the medication for the AIDS?
I have just said it.
Okay,
in this strategy.
Okay,
as long as you identify, what is important is know your status.
Yes, okay.
How do you know your status? Just go to, there are many centers all over the world. Even these chemists, you can even just go there and get tested. But there are points government provided. Just go and get tested and know your status. Because when you know your status, then you commence treatment. When you commence treatment, the virus in your body will start being destroyed or suppressed, not to produce anymore. So when we reach the level that people do not no more infectious, then you see you are preventing more new cases. Yes. So the drug is antiretroviral therapy. I mentioned it earlier. This is the drug. It is being used to suppress the they call it CD4. Those white blood cells is the one they will be monitoring to see whether they are abundantly in your body to protect you from any invading organism. Beyond the viruses, I told you bacteria, fungi, and what have you can enter your body. Okay, they call it opportunistic infection in HIV.
Okay, sir.
Yes.
So please, our final question is advice to the general public on AIDS.
Advice to the general public on AIDS is that AIDS, like any other disease, like even any common cold, or tuberculosis, or malaria, or diarrhea, or any disease, AIDS is a patient like any of those one. They need to be diagnosed, given treatment, cared for, psychosocial support. If you have malaria, this one has HIV, treat him, because people with malaria, nobody runs away from them, transmitting this from person to person. And the HIV directly from person to person if they are fluid in the body interact. So people should test first. That is the most important. Because you may think you are well, but you may be carrying these viruses. So if you are tested, you have it, commence treatment immediately, and it can be said because scientists now are working very hard to find a cure, but they are still working very hard, trying one thing or the other. But for now, no cure, but there is treatment that suppresses the virus from multiplying into your body. And you do your normal work in the society. So what the most important thing, don't discriminate on them, don't so discrimination, the stigmatization.
Thank you very
help them and support them.
Thank you very much, Doctor.
Thank you.
You're welcome. I hope next time when we invite you, you come.
Inshallah.
Thank you very much, sir. So viewers, I hope you have learned from what our special guests discussed on AIDS. We should learn to prevent ourselves from being affected from HIV/AIDS. So viewers, on behalf of my special guest, Bello A. Bello, Chairman Health Sector Reform, Sokoto State, and me, Ralia Bello, and my co-worker, Muhammad Bello, we said, see you next week on another episode on Health Hints.